I'm Jerry Rogers, RealClearPolicy editor, RealClearHealth editor, and this podcast, this webinar is part of a series that we have been doing on vaccines, on chronic conditions, chronic health, and the impact of chronic disease, the healthcare system, and the economy. And we're introducing today the small business community and how the economics, the health, what our public entities, public health entities do in terms of decisions, how that impacts the doers, the men and women who make our economy go, the small business owner, the entrepreneur, the startup firm, how health matters and how really healthcare is the business of America. It is something that impacts small business, and we don't talk about it enough, and we're going to do that today. Joining us, and we'll get to them in a second, but we're blessed to have with us John Stanford, who's the managing partner at the PrismGroup, and also Ron Busby Sr., who is the CEO of the U.S. Black Chamber of Commerce. So we are joined by two men who know a lot about this topic, and we'll get to it. But first, let's take a step back and look at health policy briefly. And that is, how does choice, access, how are these things impacted by what the CDC does, or by what the Centers for Disease Control, CDC prevention, or by its agencies and its advisory councils, like the Advisory Committee on Immunization Practices, ACIP. ACIP last October made a decision that helped small business, helped in terms of health access for patients, helped the practice of medicine when it made the recommendation to lower the recommended age of the pneumonia vaccine from age 65 to age 50. You might say, well, what does this have to do with small business, and how does this impact my health? Well, chronic disease, serious disease like pneumonia, impacts small business, and we'll get into how. But more than that, what ACIP did, and all of us remember COVID, of course, and regardless of your politics, we came out of COVID with a distrust for public health agencies. We came out of COVID with a distrust, unfortunately, for vaccines, because when the government followed the science, things went well, good outcomes. Operation Warp Speed, for instance, where we got a vaccine to market in 9-10 months, when usually a new medicine, it takes 9 or 10 years to come to market. It was a truly a medical miracle. And that was the good news. However, there was lots of politicking and a lot of politics around the vaccine, the mandates and these sorts of things. And that caused a lot of distrust. The October meeting at ACIP, which recommended bringing the age down from 65 to 50 for pneumonia, I think reset the public's trust in the public health community, or at least began the resetting. And what I mean by that is this: ACIP could have chosen one medicine. There were two approved medicines. It did not pick winners and losers. It followed the science. So not politics, not business interests. The government, ACIP, did not pick a winner or a loser. It said, you know what? The science says there are two medicines available. And the fact is, we know from science that how a patient reacts to a medicine will be specific to that patient, right? The goal of good health, good science, is the right medicine, the right time, to the right patient at the right cost. And so the ACIP decision moved us towards science again. It reset the CDC, reset, I think, public health, where they were looking at science and not business, not politics. And that did wonders for the public health conversation, but also, I think, gets us on the right track back to good science. Also, we have to consider the current circumstances, right? Politics is everywhere. Even today, this week, this month, we're talking about tariffs and trade and the economy. Well, one thing that we hear over and over again is how business likes certainty. Well, if you're a small business owner and you're not certain that your workers are going to show up, that there's going to be absenteeism, that you're going to have to close down, that you're going to have an issue with supply chain because of illness, because of chronic disease or serious disease, then having preemptive medicine, preemptive health, moves us towards building a better economy. Why? Because our economy, look, I like, what's that song, John Mellencamp? I like the big town. I always look to see who's in the big town. But the fact is, it's small businesses, it's entrepreneurs, it's startup firms. That's the backbone of America's economy. And when you allow the small business more tools to advance itself, to reinvest in itself, this is good for health, and it's good, of course, for business and for the economy. And unfortunately, too, a lot of what we hear in health policy, in politics broadly, it's left versus right, Democrats versus Republicans versus MAGA versus progressives. And that misses the whole conversation in terms of what's important in terms of health. Health is neither D nor R. Health is not liberal or conservative. Good business is not Republican or Democrat. Good business is good business. And I think when we talk about health policy, specifically vaccines and preemptive health, we got to move away from the political dynamic that dominates the cable news shows. We have to have a conversation on good science means good health, which also, it turns out, means good business, and it means economic growth. Chronic diseases, pneumonia is not a chronic disease, but it's a serious disease. But chronic disease is the leading cause of illness, disability, and death in the United States. It's the 95% of the $4.5 trillion in annual healthcare costs is from chronic disease. You add on top of this lung infections, pneumonia, RSV. Oh, by the way, ACIP put out its advisory in terms of its next meeting, and they're going to now consider an RSV vaccination recommendation, also bringing the age down to 50. Another great tool for small business. But before I give it to John Stanford, some things we just have to wrap our heads around, right? Small business is the anchor, is the backbone of American business, period. There is no other side to that. Small business drives America. The doers. What is the Teddy Roosevelt poem? The men in the arena, the men and women in the arena. That's a small business person. And so compliance with vaccines, preemptive health, dealing with chronic disease only helps our small business community. And again, and Ron and John will speak with more clarity to this, but absenteeism, its impact on workforce, on productivity, on morale. Think about that for a second. For those who run small businesses, if you've got two guys out sick, two gals out sick, and things are shutting down, and you're giving other people overtime, and they're missing time with their family, et cetera, well, then that kills morale. Missing time at work is bad for your health. It's bad for the economy. It's bad for small businesses. It increases the cost in all areas. And so today's conversation is a spotlight on the health of small business. And I am, again, pleased, and we are truly fortunate to have both John Stanford and Ron Busby Sr. with us. I'm going to right now give it off to John and let him reintroduce himself, and then what are his contributions to how we need to focus on small business and healthcare. Hi, John. Thank you very much.
Sure, Jerry, and thanks to you and Real Clear for bringing this conversation today. And anytime I get to share the stage with Ron, it's a highlight on my resume. As you mentioned, I'm a small business owner myself, running a firm of about 20 folks, headquartered in Washington, D.C., where we know that if any one of those 20 are missing, the gears can grind to a stop. Yes, you prepare for instances where a team member is away. But I think you touched on so many elements that we know to be true in the small business community, and that's health is wealth. And it is so disproportionately true for small businesses. I'm also the co-executive director of Small Business Roundtable, which is the largest coalition of small business groups in the country, and very fortunate that Ron, one of the CEOs of that group, could be here. We talk about healthcare all the time as an issue for small businesses, because if we don't have healthy small business owners and healthy small business employees, we simply can't function. And you gave a lot of great points, and I don't want to be too duplicative, but let's not kid ourselves. Small businesses are the engine that drives the U.S. economy. We are very grateful that there are large, great corporations out there. But behind those corporations, as you dig into their supply chain, who do you find? You find small businesses. You find not just innovators and scalable businesses getting venture investment, but you go down the street. Who's the main street store that you want to shop from? It's a small business. It's small business remains the number one institution in the United States. You talked about politics and Congress. As bad as their numbers are, small business numbers are at the top. People trust small businesses. And that's because they're reliable. People know they can count on their small businesses. So when we talk about something like healthcare, no small business can afford to miss 6 to 8 weeks. They're just not designed like large corporations who have redundancy after redundancy built in. You just can't do that when you're a nimble small business. And so many, when we have these conversations, I think if you ask the average American about what we're talking about, it would click for them. They'd say, yeah, a team of 10, one person's out with pneumonia. That was the example you used. One person's out for 8 weeks, 12 weeks. That could, if that's the only person who works with a set of clients, if that's the only person who has the know-how for a particular system, I mean, this is a gut punch. But so many oftentimes we talk in not in specifics, but just sort of out in the ethereal world. Well, what if someone gets sick? We have these numbers. Like you said, we just came through COVID-19. And in COVID-19, it was critically important to policymakers that small businesses stay afloat. It cost roughly $1 trillion of taxpayer money to keep small businesses going when employees and employers had to stay home. You look at the restaurant fund, nearly $40 billion that didn't even come close to helping out all the restaurants that were out there. So we know that the cost, we just paid the tab for small businesses being closed for an extended period of time because of health. So this isn't out there, well, what if? We know for sure that if small businesses lose employees or the employer for even a 12-week period, they can close. Businesses closed. I think, and Ron knows the numbers better about the Black business community, but we're talking about 30, 40% of businesses that close if they lose revenue for 8 to 12 weeks. It's critically important. And I think it goes beyond just the dollars and cents of small businesses. When we talk about Main Street and when we talk about transforming Main Street America, particularly in small towns, it was the small businesses who are first to close. And I guarantee you, ask anyone about the sign of a healthy small town, it's what does Main Street look like? And I think it's critically important that we remember it's not just about contribution to GDP and job loss that matters. It's the feeling that communities get from small businesses. And so healthcare, if we're not healthy, we can't be there for our communities. I want to turn it over to Ron in a second, but you brought up a really great specific example, I felt like, of this recent addition that the government announced that this vaccine for pneumonia would be applied earlier to 50-year-olds as opposed to 65. That's no small thing in the small business community. There are roughly 15 million small business owners over the age of 50 for whom that's a big change. Being told, hey, you can prevent having to miss 2-3 months of work now with this change. And importantly, it's going to be covered. It's going to be paid for. The science is good. It's widely available. So I just wanted to share that data point of crunching some numbers. We're talking about tens of millions of business owners here. But we're joined by not just a leader in the small business space, but also a very successful business owner himself. So I'll kick it back to you, Jerry, or over to Ron, but just so thrilled to have this conversation today.
Well, John, thank you very much. And Ron, before we give you the mic, so to speak, I'm sitting here and I'm thinking too, I had pneumonia this year and I was out for over a month. And not only did it cost my colleagues and my place of business, RealClearPolitics, and my radio show, I was out, I was absent, and it put pressure on everyone. But I also missed time with my family. I miss time coaching my kids. I miss time around the dinner table. And again, in an increasingly busy, some would say chaotic culture and public discourse, missing that dinner time is critical. What they say, the best thing you can give your kids is time. Well, you can't give your kids time if you're in the hospital. You can't give your kids time if you're sick and out. But also even small businesses, right? The cost of insurance, what's more cost effective? And I'm sure Ronald mentioned this, and that is taking a vaccine at age 50 and being healthy and getting to work and doing your thing, or getting pneumonia and being out of work for 4 to 6 weeks. What costs the healthcare system more? What costs the insurance more? A lot of small businesses, thank goodness, provide health insurance for their employees. And so again, this idea of preventive medicine is good science, good medicine, is good for the economy. It's good for families too, because like you mentioned, John, community is so important. It starts at the dining room table in terms of your own small community, and you got to be healthy. But Ron, I'm so excited you're here to join us, and I'm eager to hear what you have to say.
Well, Jerry, it's nice to meet you guys. Thank you, John, for the introduction. And this was a great conversation, especially for the Black community. Jerry, I've heard you say, well, you had pneumonia. In the Black community, we say when America gets a cold, Black America gets pneumonia. In this case, when America gets pneumonia, we go out of business. We just saw that during the months of February of 2020 through April of 2020, that same year, we lost 41% of all Black-owned businesses. That represented 442,000 businesses closed their doors. And when we surveyed them, the majority of them said that the reason why they closed their businesses has nothing to do with financial literacy. It had nothing to do with what industry they're in. It literally had to do with not getting timely, accurate information. And so to be able to have this conversation on the front end is truly amazing and a good opportunity for our community, because in our community, we distrust the government when it talks about vaccinations, when it talks about medicines, because of the history that we've had even back in the early years with the situation that happened down in Alabama and syphilis cases. And so many African Americans are saying, hey, we love the idea of vaccinations. We just want to make sure that it's coming from trusted sources that they know, as well as from the government. And they want to be able to make sure that it's going to help, not harm. Now, John has said that I was an entrepreneur and true entrepreneur in an industry that was really around people. It was janitorial services. I started the firm that took over from my father. I always say we had 5 employees: my mother, my father, my 2 sisters, and myself. I left corporate America to take over that family business and grew it from 5 employees to over 1,500 employees. The one concern that I had each and every evening was, gosh, I hope my workforce is healthy. I had businesses across the country. I had locations across the country. And John talks about one person being out. Well, can you imagine if you're in 30 or 40 different states and you're concerned about the health conditions of your employees? And many small business owners, and I know we talk about healthcare, But many small business owners don't have the luxury of being able to provide their employees with health care. So vaccinations is what most of us are saying, okay, that is going to be my preventative maintenance. I'm going to go get the shot. I'm going to make sure that I try to get my 7, 8 hours sleep. I'm going to try to eat well. But we don't necessarily always go to get the physicals, but we will get the vaccinations. But it's got to come early on in our community, and it's got to come to people that trust them and trust us, and make sure that there's some dialogue going on between the two of them. In this country, we've seen that the fastest growing segment of business owners are Black women. And Black women, although they have grown their businesses extremely fast, Jerry, you talked a lot about being at home with your family and your children. Well, imagine a Black woman who may or may not be married, may have children. Now she's got to take care of her family. She's got to take care of her children, possibly her husband, and at the same time, run a small business. The last thing that she's thinking about is, oh my gosh, I can't afford to get sick. I cannot afford, and you're talking about 6 to 8 weeks. We're talking about 6 to 8 days. Many businesses will go out of business. And so we've got to talk about preventative maintenance. We've got to talk about healthcare. I know the buzzwords of health equals wealth. Well, in our community where the wealth gap is such a huge conversation, we can literally narrow it down to talk about the health gap. And when we talk about the health gap between white communities and Black communities, it's literally around, well, where do I go to get a vaccination? Where can I go to make sure that I'm getting the preventative information that is going to be good for me, my family, as well as my employees? A good employer in today's environment is making sure that their employees know as much as they can about making sure that they are healthy. For a lot of our businesses, their employees, they look at absenteeism as a possibility of their vacation time. I get a little bit of sick leave and I got a little bit of vacation time. I can't afford to be sick because I got to make sure that I can go to my schools, my kids' school games or my school's conversations with their teachers, or I want to go make sure that I visit my grandparents. And so we look at those vacation days and sick days many times in the same vein. I want to make sure that I can maximize that so that I look as though I'm a good employer to my employees. Absenteeism is a big conversation in our small business community. The majority of our businesses aren't mom and pop, they're mom or pop. They're single employer firms, and they're looking at every way in which they can grow their firms, which they can grow their opportunities. And that starts with, I got to make sure that I have a good, healthy workforce to be able to make sure that they understand what it is we're trying to do long term. And a lot of that has to do with the health of those businesses. When you look at where we're heading now, Black business owners are looking for certainty. And in today's environment, that is hard to come by, especially when you're starting to now talk about, well, Black communities don't need vaccinations because they have a different DNA or they have different melatonin in their skins. And so there's a lot of complicated conversations going on in our community. We just want to make sure that we're getting accurate, timely, informed information in reference to vaccinations, in reference to healthcare, because we want to make sure that we're here for the long term to be able to participate.
Ron, that's fantastic. And it's, it's interesting because we could break this down in terms of Black-owned businesses, women-owned businesses, immigrant-owned businesses, and each of the segments that make up our culture and our society have different challenges. But the one thing in common is how preventative health is good for you and your community, regardless if you're in California, in LA, or if you're in rural West Virginia. The need for patients to take more control over their health is so important. You said something too that struck me, and that is communication. And you're right. Who are the trusted sources? And in many communities, it's the pharmacist, it's the doctor, it's the pastor, it's the priest. I'm from the Bronx originally, and lived in a neighborhood where when I walked home from school, I had aunts and cousins and neighbors yelling at me from the top window, "Get home, Jerry, get home, Jerry." Sometimes that woman yelling from the top window was the most trusted person in the neighborhood. So it's different from community to community. But I do want to say this, the ACIP decision, the CDC decision to recommend 2 vaccines for pneumonia, lower the age recommendation to age 50. What that also did is, to your point, Ron, it allowed for a greater communication between doctors and patients. Even if you're not going in for your annual checkup, you're going in for other things. You're going into the emerging med perhaps for other things. And because this vaccine is now recommended, doctors, it's on their foremind to say, "Hey, did you get the vax?" You know, and often, again, you're busy. You're on a business trip right now, and I've been talking to John now for a couple of weeks about this podcast webinar, and we're busy. And so therefore, sometimes when I go to the doctor, and I'm going to start going to the doctor more often, because when I say that I was on my back with pneumonia, I was in the hospital for a week, and it caused other complications. So I had pneumonia that actually turned into an heart AFib issue, and then another heart failure issue. And that if I had only gotten it checked out earlier, if I had only been more preventative, then perhaps I wouldn't have had these other healthcare situations and costs. Now, God is good, and I'm recovering well, but we don't want to always be in a state of recovery. We want to be in a state of health, and then if we do, you know. But before we go to questions, you know, I want to go back to John and Ron and other thoughts you might have. Ron,
Yeah, Jerry, in our communities, many times there's not a doctor. There may not even be a preventative maintenance or an urgent care. So our employees listen to the employer. They listen to their boss. They listen to the person they get their check from every 2 weeks. And if that person is informed and saying, "Hey guys, I need all of us to go down, make sure you're getting your vaccination," that may be the only place that they're getting health information, because after they leave work, they got to go home and take care of family business, and many times never get a chance to go and get that checkup or go see that doctor, or there may not be a place for them to even go and get the kind of medical care that they need. But in many cases, there's a CVS or a Safeway that is also giving vaccinations at the store, and many of them are getting those vaccinations right there on the spot.
You know, it's interesting, and just real quick, you know, we think sometimes if someone has a job, well, they're insured, they're all together, things are well. But you know, again, I grew up in a working class family. My dad worked for the transit authority, but he also had second and third jobs. And my mom, a stay-at-home mom, but she did childcare and she sold Avon. And my point is that just because someone is employed doesn't mean that they have leisure, that they can be off thinking about this. And no, they are busy going to their next job. And that's why I think communication, finding trusted sources, again, you know, the fact that this is recommended, the fact that ACIP made this decision makes it easier for those who are trusted sources to talk about preventive health care. And again, because I'm in DC, and because I'm a political watcher, I'm constantly engaged in policy and politics. I'm sensitive to the political discussion. And the fact of the matter is, right now, the political discussion is very chaotic. It's very partisan. And what we lose is good policy. I'll just say one more thing before I throw it back to John. That is, the Mikulski Health Force has started a monthly event in the DC area called What's Brewing. Brings together healthcare advocates, think tankers, industry, and others. And the point of it is to have a conversation about these issues in a civil manner. Be spirited, but to be civil. And I'm finding out, and I'm 55 years old. I love it that I'm learning something new all the time. I'm finding out that there's a lot of agreement on how to reform our health system, how to talk about healthcare, how to deal with preemptive care. There's a lot of agreement between left and right. And I think conversations like this will only push those who want reform maybe more towards the center, where there's more attention. Anyway, that's what we're going to do at Real Clear Politics and Policy and Health. John, what are you thinking about?
Something Ron said just was, I think it's so key that small business, something I've worked on my whole career, and Ron and others that we haven't solved, is the broken healthcare payer system facing small businesses. There just isn't a good option to provide health insurance to your employees. That's something that didn't get solved in the Affordable Care Act. Still, I mean, we have HRAs, we have ICRAs, we have QSERAs, but we haven't figured it out that every small business is offering its employees health insurance like is assumed in the corporate world. So what really struck me is Ron's point is you then reach out into the gig economy, 1099s, and the smallest of small businesses. It's this patchwork of healthcare that becomes health insurance. And that's really profound. And therefore, preventative things you can do. Because God forbid someone on the team gets a cancer diagnosis or needs a very expensive gene therapy for a loved one. We haven't solved those problems for small businesses. But what preventative medicine has done is dramatically change the calculation of costs. So by being able to say, we can go out and be preventative, we can get the flu vaccine, we can get what's on the recommended schedule, and we can go see the doctor. That's not a substitute for full insurance, and that's a policy that needs more work. But I think Ron's point that preventative is what we can do and what we are doing is really important. And if we think of half Americans work at small businesses and half work at large corporations, we're talking about half of America for whom their employer-based insurance calculation is a bit of a question mark. So anything we can do to keep them out of the hospital keeps the wildly high costs down by something as simple as a vaccine, which is most likely covered. That's really compelling. And so credit to the folks who advanced that at ACIP and brought these medicines forward, because those are the things we can do as small businesses. Everybody on the team, let's go get a flu shot so that none of us lose a week. Because Ron's right, it's not a 6 to 8 week. For some businesses, it's 6 to 8 days. 5 days not touching your clients might mean your business goes under, and that's catastrophic.
There's lots of numbers in terms of the impact of small business on our economy. I keep on coming back to the politics of it because I think for too many on the right, they see health policy as something the left does, or that's a Democratic issue. And I think that's wrong. I think that if you think about the enormous impact, the enormous space healthcare takes in our economy, to leave this to one side or the one side will take care of this and we'll come in and we'll pare it down, or we'll fix the extremes on it, I think is bad policy. Again, in the last 25 years, almost 70% of all net new jobs in America created by small businesses. When you think about think about when we talk about the economy, right? A lot of it now, because we're talking about tariffs and the cost of items and wage growth, we're talking about the economy. Well, if we're talking about the economy, and economic growth, and we hear about America's enormous economy and how even with COVID and even with the problems that we have, we still have the biggest economy in the world. Well, we have that because of small business owners. Because remember, for those listening, large corporations will cut workers if it means a better profit, if it means a better situation for their shareholders. So big business is not a driver of jobs. It's the small business person. It is the entrepreneur. Again, it's like what Teddy Roosevelt said. It's the man and woman in the arena, the doers of our economy. And I think that if you think about healthcare as an economic issue, it resets it. It puts it in a different narrative. And I think that more of our elected leaders on both the right and the left, but specifically on the right, need to take better ownership of this. and look for policies that advance good science, good health, because it's good business. Ron, any thoughts on how politics impacts the discussion around healthcare or around vaccines?
Yeah. You know, when COVID happened, it wasn't a Democratic virus or a Republican virus. It was a virus that affected everyone. And so to have a vaccination that can affect everyone in this country from a positive standpoint takes it away from left and right or Republican and Democrat. This is a solution that we can all participate in that will benefit all businesses, both small and large, both those that are working for the government as well as those that are working for the public sector. But for my community, we saw the impact that it had when we didn't have a vaccination, when we didn't have good information. And so my community, it really is about having good conversation, about creating a policy that allows us all to participate in. And I believe that when we have good dialogue, it takes it away from politics, and it really is about the health of this country makes the wealth of this country. If people get sick, and we saw it during COVID, the country stops, economics ceases, unemployment obviously takes a big hit. And so for us, this is not a black and white or a left and right. This is a, hey guys, I want to be as healthy as possible. I am 66 years old. If I could have gotten a vaccination at 50, it would have truly been a conversation that I could have had with my employees across the country to say, hey guys, this is good for everyone, young and old, black and white, North and South, Republican and Democrats. The one thing that I will say that happened that was great from a business standpoint was, and I know this may not necessarily get everyone's excitement, was the Community Navigator program, which really said, hey, look, go out and talk to small businesses about what the federal government has to be able to provide resources. And when we were doing that, we didn't ask who you voted for or what party you affiliate yourself with. We said, hey, if there's a need in your community, the federal government has resources and we're here to talk to you about it. And I think when we can have those types of broader conversations, and we can really take politics out of the conversation, because this has nothing to do with politics. This is really about health. And I think all of us are concerned about the healthiness of our businesses, our families, as well as our communities.
You know, years ago, and I'm gonna be a little ageist for a second. I think John's a little younger than me and you, Ron. But I remember back in 2003, I was working in D.C. It was the debate around the Medicare Modernization Act. And it was, again, bringing a drug benefit to Medicare, which, you know, as a public policy person, why you'd have an insurance program without a drug benefit, it seems crazy to me. But regardless, it was controversial, right, to add this benefit. But I remember going to some of our conservative friends, the Heritage Foundation and some other public policy groups in D.C., and they opposed this. At first, many of them opposed it because it was we're expanding government. And I remember sitting with top leadership, with these men and women, saying, "Do you think George Washington was a radical? Do you think? I mean, was he a Democrat radical? Would he vote for Dukakis? This sort of thing." And they were like, "Well, no, Washington, if he was alive today, he'd be whatever, right?" I mean, it was a speculative and fun conversation. But then I turned it around and I said, George Washington understood healthcare as a public good. And there's evidence of that because he put public health officers of the federal government at the ports in the U.S. Why? Because food and disease, right, and healthcare issues would arise at ports of entry. Well, if George Washington in 1789 recognized health care as a public good, I think adding a drug benefit to the MMA, or the MMA adding a drug benefit to Medicare isn't controversial. And I say that to say this: I don't think it's controversial to say to your workers or to say to men and women age 50, go get vaxxed. for pneumonia. I just pulled up a figure when you were talking. Pneumonia costs American healthcare nearly $2 billion a year in direct medical cost. Think about the productivity. Think about the wasted time. Think about the impact of small business. Think about the impact on families. $2 billion. Now imagine you take that $2 billion cost away and you have productive citizens. Well, then what are we doing? We're building the economy, we're building wealth, and we are pushing up wages. So to me, this is a no-brainer. If there is a good science, go and follow the science. And again, for pneumonia, and I speak from personal experience, go get the vax because it's better than laying on your back. John, what do you have? We have a question for Ron though. We're getting questions, guys, from the audience. Let me. I'm going to read this. I haven't read it yet. I want to read it right now. So, Ron, we're putting you on the spot. Question for Ron: what role community leaders and mentorship play in assuring Black entrepreneurs to sustain their businesses and personal well-being? What role do community leaders and mentorship programs or mentorship play in sustaining entrepreneurship in the Black community?
Great question. And it kind of goes back to what we began talking about. In our communities, many times we don't get information from sources that have been trusted. In the case of COVID, it was folk coming in to our communities talking about vaccinations that we didn't know, that we did not had not heard from in the past. And so when you hear from community leaders, church leaders, business owners, business organizations that you have had a relationship with, and they're giving you good recommendations, it is usually implemented in those businesses and families because of the relationships that have been built over years. I was a small business owner prior to coming into this role as the U.S. Black Chamber. I had a mentor. He was a large business owner that had grown his same organization from a very small business to a larger business. And he always told me, Ron, make sure you're taking care of the health of your employees. The weakest link can ultimately break the chain. You can't say, well, I got 2 or 3 people that are sick, we'll be okay. Those 2 or 3 people that get sick end up having other people get sick or people in their family get sick. So now they have to stay home to take care of their family members. I was in janitorial, so I had a lot of employees that were working very labor-intensive jobs. Black businesses are usually in labor, usually in service industries. And so for us, we got to make sure that we have people. AI is not going to be able to participate in many of our small businesses because we still have to have hands-on. And when you lose those hands because of health conditions or the lack thereof, that's when our businesses are faced with challenges that we aren't prepared for. And so to answer your question, mentors, trusted sources, trusted leaders in communities have the biggest impact in making sure that things are implemented and understood in communities of color.
Yeah, and I think that's broadly speaking as well, the idea of mentorship, the idea of giving someone else that kind of hand up. Here's my experience. You can't learn experience at university or even at a trade school. It's something that you got to do alongside someone else. I like that idea of bringing along somebody. Another question, and I guess I'll leave this to both John and Ron. The impact on women's businesses.
Yeah, I'm happy to jump in, and I think Ron alluded to that Black women are the nation's company creators right now at an incredible rate. The data on women-owned businesses is always sometimes challenging to come by, but knowing that the Great Association of Women's Business Centers Beyond did a little homework. And while we don't know the specific number of women over age 50 who might be applied to the change you referenced, Jerry, we know that women over the age of 50 are starting businesses at twice the rate of younger individuals. And that makes sense. These are people who have led successful careers and now are going out on their own. And I think what's vitally important as that segment of our GDP created by women-owned businesses continues to grow, there's a fragile period there where you leave the safety of corporate America and you're going out on your own, where you are the linchpin. And if something happens to you before you can build a team around you and scalable processes and the structures that provide redundancy, if something happens to you, it's a gut shot. And I think Ron's points earlier about also in many places in society, women playing an outsized role in the entire family's healthcare decisions, it's just even more pressure. And so we know that pneumonia can be really challenging at a population that is currently thriving. And so it seems foolhardy not to say that this growth of encore entrepreneurs, people who've finished their careers in corporate America and are starting businesses, they've got to protect their health just as much as they've got to protect their IP.
We're coming up on the hour, and one thing. Again, I grew up in church, and it always bothered me when you were told to show up at 9, but church didn't get going until 9:30. So I want to be respectful of people's times. We're gonna close things down. But there's a question here from Bob Goldberg from the Center for Medicine and Public Interest. I just missed it, Bob. So maybe I'll ask our producer if you see Bob Goldberg's question before we end. I want to make sure that we get Bob's question answered. Bob Goldberg did some good work for RealClearPolicy. He did a white paper on pneumonia vaccines. He has been a leader in healthcare policy for years. I won't give your age, Bob, but I know that you've been involved in this. And while we get your question sorted out, I want to throw this at the group as we begin to wind down. Bob's question will be our last question. I want to wind this down. In business, you want the best technology. You want the best workers. You want the best. Oh, there's Bob. You know what? Before I close out, there's Bob Goldberg right there. Hey, Mr. Producer, why don't you unmute Bob and let him ask his question? Hey, so again, for our audience, Bob Goldberg is again, he is one of the most important economist thinkers, advocates, and think tankers on healthcare policy. So the fact that you joined this call, this webinar, I appreciate it. Now, of course, it'll be posted, Bob, up at RealClearHealth and Policy. But go ahead. I'm very curious to hear your question or your statement.
Well, it's basically, first of all, focusing on pneumonia is we've made enormous strides in reducing pneumonia-related mortality because of the vaccine. But having dealt with it, as you know, I lost my father at the age of 100, and pneumonia did him in. What I found was, and this I applied generally to keeping people healthy, that home-based interventions, just going to people's houses, which is what people did in the public health community in the 1950s, door to door, addresses two issues. And one is the lack of transportation, particularly in medically underserved areas, and promotes continuity of care. I'm just wondering whether, from the small business perspective, are plans offering that as a service, or is it something that we need to get is there a policy that ought to be tweaked or implemented to keep everybody healthy using that modality?
Bob, thank you. And again, if folks want to hear more from Bob, the Center for Medicine and Public Interest, he's the founder and co-president and vice president there. So, but I'm going to leave it now to John and Ron on, what about the home visits and home intervention? My father's 86, and I thank God he's still with us. But just this past week, we started home visits. His primary physician has come to the house. Now, my dad has insurance through his retirement plan. He worked for the state of New York, but he also has Medicare. But watch the situation for small businesses in terms of home intervention. Ron and John.
I'll go first. I'll let John finish. I think it's a great idea, but I think we can use technology along with the home visit. I think in many cases, for my community, our businesses and employers are going to be at work for a lot of hours. They may have, as John stated and as Jerry stated, 2 or 3 different jobs. And so it may be difficult to catch them at home, but we can use technology through webinars like these, through opportunities where we bring people together to be able to have those conversations. I think in my community, it's not so much about having that one-on-one conversation as much as it is about, hey, guys, this is something that's good. And we usually, if it's coming from someone that we have trusted and have known previously, and they say that it's good, it's beneficial, then we usually, with some questions, no one is just taking anything lightly. But in today's environment, when we get good information, hopefully we can implement and act on it. The conversation has got to be about getting good information, timely information, and proactive information as opposed to reactive information. And so when we have conversations like the ones that we're having this morning, I'm truly excited about the opportunity to be able to carry this conversation back to my community, back to the business owners, as well as family members around the country that are looking to make sure that they continue their wealth as well as their health.
Hey, before I do close things out, John, what about, is there a policy tweak? Is there something that we can do for small businesses in terms of policy changes to have at-home visits and home intervention? Again, for my dad, having his primary care physician come to the house is a lifesaver. And it's important. And I think for his longevity and for his health, even at 86 years old, it's beneficial. But again, he has insurance through his retirement. Is this something that is an option for small business owners and small business employees, or something that we should investigate more?
Well, I won't pretend to be an expert on CMS and insurance policy.
Well, I thought you were the expert. No, I'm joking.
But I can play one on TV, and that's what we're doing here. So,
yes.
Yeah, I think there are lots of things that if you asked, a 10th grader about our healthcare system, they could point to 40 flaws. That we haven't fully embraced telehealth to the maximum of its potential. And I know we have some expiring COVID authorities that get someone into the home without them leaving the home. I think, but the fundamental to your answer is, until we fix the affordability crisis of insurance for small business owners, insurers just don't want to play in this space. It doesn't fit their risk profiles. So until there's a true small business insurance option, then we can talk about making sure that it does have things like in-home care, because I'll close on this particular piece by saying e-commerce businesses, booming. We know that so many people are going digital and running huge brands out of their garage. I think getting to those people who are at home, sort of the counterpart to what Ron said, it's a good idea. But we got to get some healthcare to the small business community. But in the meantime, preventative stuff like we've talked about today, it's the next best thing.
I want to thank John Stanford. I want to thank Ron Busby Senior. Thank you so much. I want to thank Bob Goldberg for popping on a special guest appearance. Bob, the question that you raised is something that I think at RealClearPolicy we want to look at. And why don't you and I talk offline about raising awareness here? And again, home intervention doesn't have to be for a 100-year-old or an 86-year-old.
No.
When I was on my back with pneumonia, I couldn't get to the. I mean, I couldn't move. I couldn't get out of the house. And so home intervention there would have been helpful as well. Do you have a last word, Bob?
Well, I just want to say that I agree with Ron that it doesn't have to be. You don't have to just go totally old school. You can use AI to identify those individuals or people that might need care to, because they may be at risk. And then secondly, you actually increase the likelihood that someone's going to use a digital tool like telehealth if you go face-to-face first. Not all the time, but again, we have the ability now to sort of customize the fitting. And finally, yeah, we've got to figure. We got maybe sit down with the payers and the government to say, you got to make this affordable to the people that are growing the economy.
Yep.
So I agree. This is not worrying. I'm not worrying about the Yankees getting good health care. I'm worried about the guys who clean up in Yankee Stadium getting good health care.
Amen to that. 21st century medicine, right? We're now well into the 21st century. And that's a term that Bob Goldberg coined when he was writing and doing work for the Manhattan Institute back in the 20th century. But 21st century medicine depends upon preventive care. It depends on getting vaccines. It depends on following good science. It depends upon trusting public health entities again. And I do think that preemptive care is important to patients. It's important to the public health. It's important to the economy. And I think more talk about how we can support the small business community, because it increases wealth in our country. And health does equal wealth, and wealth can be defined differently, but we need better policies. And ACIP again did that when it recommended lowering the age to 50. Again, its next meeting, the RSV Vax is up for a similar recommendation to lower the age. My hope is, I'll say it now, if ACIP listens to Jerry Rogers, lower the age to age 50, because I think it's good science and good health. I want to thank our panel. I want to thank Bob Goldberg. I'm Jerry Rogers. I want to thank our producer today. And this program will be made available at RealClear, and we'll have others in this series moving forward. But I'm Jerry Rogers, and this was a conversation on the health of small business in America. Thank you very much, and we'll see you soon.